Friends, topic of today is food-induced cough. Many people have mysterious cough after eating. It might happen after every meal or only occasionally, and hence this topic is taken. A few words about cough. Cough is a natural defense mechanism that protects the respiratory tract from inhaling foreign bodies, clearing excessive bronchial secretions and irritants in the throat. This is a spontaneous reflex which involves receptors present in the respiratory tract, vagus nerve, central processing center in the brain, motor nerves and effectors like respiratory muscles and diaphragm, resulting in cough. These are the causes of food-induced cough. The first is disease associated with reflux. They are of three types: acid reflux, gastroesophageal reflux disease, in short called GERD, laryngopharyngeal reflux, which is also called silent reflux. Reflux is of stomach acid moving up into the esophagus. Lower end of esophagus has a sphincter called lower esophageal sphincter, which is generally closed, but it relaxes when we eat or drink. When it does not close properly, the stomach acid goes up in the esophagus, irritates the esophagus, leading to cough. Symptom of acid reflux is burning pain in the chest, which is also called heartburn. When the symptoms are severe, like regurgitation of stomach acid up to the throat or in the mouth, burping, bloating, then the condition is called gastroesophageal reflux disease. In case of laryngopharyngeal reflux, there used to be no heartburn, but the stomach acid, sour and bitter, goes up to the throat or in the mouth. In some persons, just after taking food, the person experiences cough. This is called food allergy. The other causes are respiratory infections, asthma, and difficulty in swallowing, which is also called dysphagia. The remedy of food-induced cough are three. First, change in eating habits. Second, lifestyle changes. And third is specific treatment. About eating habits, one should avoid overeating. Eat slowly and chew well before swallowing. Take small sips of water between bites. Do not eat food less than 2 hours before bedtime. Raise the head of your bed before sleeping. Sit up straight and avoid eating while lying down. Keep a food diary to see the pattern that increases the risk of coughing after a meal. Don't eat during a coughing attack. Regarding lifestyle changes, avoid spicy, fatty, fried foods. Do not wear tight or binding clothing. Avoid becoming overstressed. Lose excess weight, exercise. Avoid alcohol and smoking. Avoid beverages that contain caffeine, that is tea or coffee. Take all your medications, especially those for acid reflux or asthma. Taking honey or sipping on warm fluids relieves cough. Consult your physician if there is no relief. A specific medical treatment is required in case of asthma, where airways blockage is to be there with inflammation and irritability of the airway. Respiratory infections, which may be due to bacteria, virus or fungus, and dysphagia, which may be due to the spasms, stricture or tumors of food pipe. Gastroesophageal reflux disease may also cause dysphagia. Thank you.